Hello, here is Dr. Vladimir, and this is a video on how to mix and prepare MF Plus Ultra Human Growth Hormone for the further injecting. And now we can start. So first you want to gather all your materials. So here we have 1 ampule of Ultra HGH, alright? So, and then we also need a separate vial with bacteriostatic water for diluting Ultra HGH. Then we also need alcohol swab, right, for disinfection, and syringe and needles, as well as the sharp container, of course, if you have one. And last but not the least, gloves. Okay, so how do we mix? First thing you want to make sure, you want to make your hands clean. So it works only if you don't have any gloves. Therefore, you need to wash your hands and sanitize them. Or you can sanitize your gloves, all right, if they're not sterile ones. But today, I'm going to use sterile ones. Then you need to remove cap from the vial of human growth hormone. Then use the alcohol pad, alcohol swab, and sanitize the top of the vial in a circular motion, all right? And in the meantime, you need to sanitize your vial of bacteriostatic water as well, all right? Just make it clean, sanitize it from all the sides, all right? And now I'd like to mention that bacteriostatic water prevents microbes from developing inside the vial. This prevents them from destroying the growth hormone. This is why you're supposed to keep the reconstituted solution in refrigeration, or eventually it loses potency. However, it is unlikely that bacteria will ever get into the vial if you keep the vial stopper clean and if you only use sterile and new syringes. So now you need to take the syringe out of the package and attach the needle, making sure you don't touch the tip of the drawing needle of the syringe to anything else. But of course now it's under the cap, so it's fine. Then next part. So we need to open the vial with the bacteriostatic water. Make sure you do it carefully and using a piece of cotton. So make sure the yellow dot that is here that is in front of the vial looks right in front. And then you cover it with a cotton pad carefully, just not to hurt yourself, and just open it. Now it's done. So to mix water and powder, we usually use a large needle. Like I said, it could be 3 cc or 5 cc syringe, or 18, 21 or 23 gauge needles. So these are actually big ones, but don't worry about the big thick needle. You only use it to mix. You will not inject it into yourself, into your body. Now I'm going to draw all the water out of this vial and inject it into the vial of Ultra HGH. There is not a lot of water in here, only 2 ml. So you make sure you draw all of the water out, okay? And then inject it into the vial with HGH. Now, to get all the water out, we are going to put the needle inside, right? Just down to the bottom, right? If you might see it, right? Down to the bottom of the vial until the needle tip is just there, and then we are going to begin to draw all of the liquid inside until it's here. Okay, we can release some air, and then to draw all of the liquid, make sure that there is nothing inside. Okay, we are good now, no water, and we release some air until we are good. And so, okay, now we will inject the water, bacteriostatic water, inside of the vial of Ultra HGH. And when we insert the needle, right, you want to make sure that it is an angle. So we don't want the stream of the water to go directly on the powder, right? as we want to angle it in such a way so that the water hits the wall. We go inside, and then we angle it in such a way so it doesn't that it drips down on the wall, but not on the powder. And we go slowly, 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 slowly. Push the plunger. Sometimes, you know, it sucks the liquid, the whole liquid inside, but you just need to press slowly so the water drips down, not directly into the powder. So it would be the best if you inject it slowly, as I said. Do not inject forcefully, as the AGH will turn into the foam. And why it's important? Why it is important? So foam might stick to the inside of the vial, causing loss of human growth hormone. For the same reason, do not shake it, the AGH vial, during or after mixing. Instead, slowly roll. You can do it like this. Or you can shake it, but very gently, very gently. One more time, keep it refrigerated after the AGH is fully dissolved, but do not allow it to freeze. Then I already put the cap back on the needle, so you can twist the needle off and then throw it into the sharp container. And if you have that, of course, and then the syringe into the trash. All right, and so we are done with the step. So actually it is ready for your nightly injection. So what's the protocol for injecting MF Plus Ultra HGH? MF Plus Ultra HGH has to be injected during 5 consecutive days. The dosage for every injection is 0.4 cc, and the whole course of injecting could differ from 3 to 6 months, depending on your objectives, of course, and recommendations of your health practitioner who recommended you this therapy. Well, I need to admit that HGH levels and insulin resistance are strongly linked. Since insulin performs its essential function shortly after a meal, it is important that HGH injections be taken several hours after the last meal of the day, well, in the best scenario, and the minimum is 30-40 minutes after having your last meal. By injecting the hormone shortly before sleep, the body is able to maximize the effects using the natural cycle. And within the normal human body, HGH levels are periodic. Therefore, in order to maintain a healthy balance within the body, deep and sufficient sleep is required, since it is during this time that HGH production rises. One more time, you can perform the injection straight away after dilution, but don't forget to sanitize the rubber stopper before every next withdrawal. So next time you do injection, you'll need to open your fridge, take the vial with the AGH, right? Sanitize the rubber stopper with an alcohol pad, and then start to draw AGH and inject it later on. So now when you want to draw out AGH from the vial, so you can measure it, or you can draw out it with the help either of 3 cc syringe or insulin syringe. For this purpose, you also need to use needles, right? So you may use either 27G needles, half inch, or 30G needles, half inch each. So now I'm going to show you how exactly 0.4 cc, which is the dosage for one injection, looks like inside of the insulin syringe. I'm going to open it, then I'm going to put the needle on, remove the cap, then we go into the rubber stopper, and then we pull the plunger back, release a bit, okay, so this is exactly the dosage of for one injection, for one session, for one time in an insulin syringe. All right, I put the cap back, And now I just want to show you, in case if you use 3 cc syringe, how does it look like when you use this syringe for withdrawal and further injection. All right, we put the 27G needle, 1/2 inch on it. All right, remove the cap, go inside the vial, and then we just need 0.4 cc. Some air went inside, no worries. Go back. So just, okay, you see 0.5, right? Then go a little bit upper. So this is, release a little bit of hair, you can always release it, do like this. So yeah, it's relatively in the same position. So 0.4 cc, this is what you need to inject for 1 dosage. Please make sure you withdraw enough of AGH for 1 session. AGH should always be injected subcutaneously. For example, just below, just below the skin and into the fatty tissue. The best size is the abdomen area, okay, and thigh. So simply make disinfecting of the skin first. Disinfect the skin into the place where you see some fat, all right? Then remove the cap, pinch the skin. I'm not going to inject it now, just because it's basically not the time. Make sure the angle is 45 degrees. Then make an injection, put the needle in to your body, then start to slowly inject it, and then release the skin. Then, while all the AGH is inside, remove the syringe, sanitize it, disinfect it 1 more time, and then you are done. Put the cap on, throw the needle, throw the syringe. That's it, you are done with the injection. And you need to alternate the sides to avoid bruising. Certainly, the dosage could sometimes be adjusted depending on the case. That's why you should always look for a consultation of qualified doctor, qualified practitioner. Otherwise, the whole procedure is quite simple and very straightforward. The only issue that sometimes occurs is minor soreness or bruising at the place of injection, but it is a common problem. That is why it is advisable to change the place of injection on and off. How soon will I see and feel all the results? You'll begin to feel them sooner than you will start to see them. I'd say if your dose is adequate and you take growth hormone with the constant enough frequency, you will probably know it is working by the end of the first week. After about 2 or 3 weeks, you might notice a slight improvement when you look at yourself in the mirror. And you will see more and more good results steadily for about the first 5 or 6 months, after which you will stay well, but you won't improve as dramatically as you did within the first 6 months. Another question is, what results can I expect from taking growth hormone? The results will depend on the dose and frequency with which you take growth hormone and what can be fixed in your body. So, growth hormone will help you to gain muscle, make you lose fat. Then growth hormone will improve your skin condition. But if you're very young and you have very nice skin, it would be very difficult to notice a dramatic improvement in your skin. However, growth hormone will repair and protect your body. Thus, you can expect injuries to heal faster. You can expect your immune system to be strong, so you will not get that many illnesses. And you should also expect your hair and your nails to grow faster. You can expect to feel much more energy. And on top of that, you can feel yourself more optimistic and less depressed, as well as you should expect to sleep better and look younger. If you have any questions, please contact our office or visit our website. Thank you so much.